Delighted now to welcome back to the stage to talk to us about healthcare and more about zero waiting lists. Ladies and gentlemen, Dr. David Ball.
Well, a very good afternoon to you, ladies and gentlemen. It's my great pleasure now to talk to you about a subject, of course, I am very, very passionate about, and that is the subject of health. And what has been driving this whole policy has been one question: how do we achieve a great British health service? And I have to tell you, I am delighted because I think we have a really bold, ambitious and radical plan. And I'm going to unveil it for you this afternoon. I just want to put it into context. I started practicing medicine, I can't believe it, 30 years ago, almost 30 years ago. And one thing that strikes me whenever I think about us, our families, our health and everything, is that actually, I'll just show you the first slide, health is the great leveler. It doesn't matter where you're from, how much money you have, how much in terms of resources you have. If you do not have your health, you don't have anything. Health is absolutely critical to everything we do. And by that, I don't just mean physical health, I mean mental health. Let's look at what we've done to older people, locking them up, isolating them in COVID. It is absolutely immoral what we have done to these people. And you see, health, it underpins everything we do. And in fact, when you meet someone for the first time, what do you say? How are you? How is your health? That is what you're asking someone. And that's why it's so important. And that's why I'm really, really passionate that we really have to fight to have the best healthcare system in the world. Not a mediocre one, not one that's okay if you live in the south and pretty rubbish if you live in the north, not one that's okay in certain parts of the country if you have a certain type of cancer. No, we need to have really good healthcare across the country, and it shouldn't matter where you live or how much money you have. And that is where we need to start this debate. So before I carry on, let's just look at a few key points. I think it's fairly clear to say the NHS is probably the best loved medical system in the world. I think we all know and appreciate and value the frontline care. I think particularly in the COVID crisis, we've shown how we can pull together as a country. And it has been remarkable, and hats off to all the doctors, nurses, healthcare assistants, and everyone who's been involved in that. But as Richard said in his speech, I don't think anyone believes it is the best managed or the most efficient system in the world. One of the biggest problems is that the NHS has almost become a national religion. And even with the clapping for carers, which started off as a really admirable thing to do, it has actually reinforced that the NHS is a national religion. And so when you try to make constructive criticism of the healthcare that the NHS is delivering, it's seen as heresy. It's almost like the golden goose. You cannot actually talk about it, however well-intentioned that criticism is. And that is why it is so important that we accept the NHS does some things really, really well. And some things it doesn't do very well. But we have to actually acknowledge that, because unless you know there's a problem, you can't fix it. Let me tell you a stat. When you look at the data, the truth is the clinical outcomes in this country are worse than in other countries, in 10 other countries, and in fact, we're not often in the top 10. And that is a shocking record. So all the rhetoric from politicians telling you we have the best healthcare system in the world is wrong. We don't. We pay a lot of money, and some of it's good, but it is not the best health system in the world. And we hear a lot from groups, medical groups like the BMA, like the GPs, if you can get an appointment, And they are saying that the solution is to throw more money at the NHS. Now, that isn't actually the solution, and I'll come on to why that is. But it is worth remembering that both the BMA and the GPs opposed the creation of the NHS in 1948. And the only reason they voted that through, and they were worried because they would lose their private practices, they voted it through on the provision that they could have a different type of structure. And most people don't realise that GPs are not salaried employees of the NHS. They are partnerships that work in tandem with the NHS, and they are profit-driven. So GPs provide a service to the NHS, and the overarching care remains free at the point of delivery. Richard and I are very passionate that the NHS is really important and must form the backbone of our health offering going forward. And it is equally crucial that it remains free at the point of need. So I want to look at some facts because this will help you to understand how we've arrived at where we are. Let's look at the number of hospital beds. So here is the number of hospital beds. When I was at medical school, we had 300,000 hospital beds. Today, we have 140,000. It has halved. And in that time, we have 10 million more people living in this country. So how on earth do you expect us to find a bed for everyone who is ill? It is simply impossible. And when I was a junior doctor, I wanted to discharge patients. And when you want to discharge a patient, sometimes you can't, they're clinically well, but for example, they may not have slippers. They may not have their heating turned on. Social services need to go in, and you need to do something with them that keeps them protected, but at the same time, I don't want them to use an acute bed. And we used to have these things called hospital wards where we could discharge people into as a sort of holding pattern before we could discharge them. They've all gone. There is no capacity. There are no beds. There is nowhere to put anyone, and that is a real problem. Let's look at staffing then. So we talk a lot about doctors and nurses in the NHS, and actually if you look, we have the second lowest number of nurses when you look at this graph, and only the average number of doctors. And then people say to me, well, the reason for that is because we don't put enough money into the NHS. Well, actually we do. Let's look at health spending in the NHS. I think that will surprise you. Does that surprise you? The fact is, we spend an awful lot of money on health, and as you know, the government has just added another £36 billion to the health service, which is meant to go into social care. It will never go anywhere near social care, I can tell you that now, and it will be swallowed up by the NHS. So what am I saying? I'm saying we're actually putting a lot of money in, but our outcomes are not very good. So I've broken that heretic thing. I am saying that sometimes it's good and sometimes it's bad, but it can be better. Now the question is, where is our money going? And that's where I'm going to come on to next. And I just want to make one other point. When you look at fixed assets, such as MRI scanners, we have fewer MRI scanners than Estonia and Slovenia. So where is the money? And that's the question that keeps coming back to me time and time again. Now, before I tell you what our plan is, I think we need to understand what the problems are, and I'm sure you know what they are, but I think there are 5 of them. 1, waiting lists. There are 6 million people waiting for elective procedures. We believe that it will be up to 12 million people waiting for elective procedures. That is a lot of people. So we have waiting lists that we have to tackle. Staffing. We've seen about the doctors and nurses, but there is a major problem in retaining these medical staff. And I know this, talking to my consultant colleagues, there are far too many managers in the NHS asking doctors to fill in data sheets for administration, for various amounts of bureaucracy. The problem is, the minute you set a target, you have to have paperwork to decide whether you have met that target. And then you need managers to work out what to do once you've worked out what your outcomes are. All of that is ridiculous. Does it actually improve patient health? No, it doesn't. So it needs to go. I mentioned very quickly there aren't enough hospital beds. There's no capacity. It's what we call running hot. And every winter we're surprised when we have flu. Why are we surprised? And every winter there is a crisis in the NHS. Well, there will always be a crisis unless we have capacity. I'm not saying fund it more. I'm saying get more capacity and get more beds. And the final problem I see is the poor patient is at the mercy of the medical system. You are told to jump, and you say, how high? So we, as patients, are subjected to the whims of the monopoly providers, and that has to stop. The patient must be in control, and the money has to follow you, the patient, and the choices that you make. And that is going to underpin our proposals. So here we go. I spoke to lots of doctors recently, and privately, they'll never say this publicly, but privately they will all tell me, and I said, how long will it take to clear the backlog of 12 million elective procedures? And their answer is, we will never clear it. It is not possible to clear it, given the resources we have. And what they have said, time and time again to us, is what they need is a bold, ambitious, radical plan. And that's what this is. So, our first pledge, as Richard outlined, we want to get to zero waiting lists. We think this is possible within 18 months. And I'll tell you how we're going to do it. We will use a voucher system. So, if you cannot be seen in a certain time by the normal NHS provider, you will be given a voucher paid for by the NHS, and that voucher will then unlock private sector provision. So let me tell you, if a patient wants to see a GP, and I've tried to see a GP, which is fairly impossible, you get given a voucher. If you can't be seen in 3 days, you get a voucher, you go to see a private GP. If you can't see a specialist in 3 weeks, you get a voucher. You can go privately and liberate that private capacity. And if, say, you can't have an operation in 9 to 12 weeks, then you also get a voucher. And let me tell you, waiting lists are very unusual in Europe. But in Britain, we've come to accept them. We say, how long are you waiting? And it seems absolutely normal to say, oh, I'm expecting an operation next year. Not acceptable. We need to get to zero waiting lists. And what we believe this will do by using this voucher system, essentially what we're going to do is to mushroom private capacity. There is capacity in that system. Many doctors work privately and they work for the NHS. And what we're saying is actually we need a national concerted effort all together to get these waiting lists down and to keep them down. And so by issuing these vouchers, it will balloon the private capacity, bring medical staff in who may work extra weekends, for example, or extra clinical sessions. Well, that's going to be interesting. So I hear, apparently, we have rattled the Conservatives because our bus has been out and about in Manchester, the press know about it, and some nasty Conservatives were so rattled by the health policy, they pressed the fire alarm. Exactly. Right. I'm just going to recap very quickly. So a 4-point, bold, ambitious plan. I had some really nice chats, actually, outside with people asking me about the detail. Detail is important. We'll come on to talking about that once those policy groups are established. But I really want to just outline the principles. So we are saying, as a party of government, we will have these bold, ambitious plans. That's zero waiting lists, 18 months to bring them under control, and then keep them under control, but the NHS care remains free at the point of need. It's really important. And the use of private sector provision is not new, and the voucher scheme is not new either. It was introduced by Labour in 2000. So we know it works, and we know it will drive capacity. So let's go on to our second point. The other thing I'm desperate to do is to improve management and reduce waste in the NHS. Do you know the NHS is the third largest employer in the world, behind the Indian Railway and the Chinese National Army? And I can tell you that 48% of the money spent on staff is on non-clinical staff. They don't see patients. So what are we doing? That has to stop. Many of my friends who are doctors tell me they are bullied by managers. They are not allowed to operate because the managers say they cannot operate. And this relentless bullying, and in my opinion, it's upside down. Doctors should be there to make clinical decisions. And managers are making clinical decisions. It's the wrong way round, and again, it has to stop. There is also huge disparity in the amount that we pay people. I was talking to a lady earlier today who may still be here. She said her daughter is a midwife. Midwives work incredibly hard. Do you know how much a midwife earns? £30,000. Do you know how much a diversity manager costs? How much do they get paid? £70,000. That cannot be right. So let's start paying the clinicians, the doctors, the nurses, the healthcare assistants properly. And whilst I'm on my favourite subject of managers, let me tell you that if you leave school at 18, there is no structured managing course. You do not have to train in any particular way to become a manager. So it is perfectly possible to have never touched a patient, to know nothing about medicine, and to then run a £100 million budget. Now, to me, I'm not a manager, I'm a doctor, and I think that is completely ludicrous. One of the other things that I'm very keen to do is to put the patient back in control. In COVID, we've heard a lot about protect the NHS. Well, I thought the NHS was there to protect us. I do think we need to have a very serious conversation with the public about how much things cost. You see, when I talk to people, I say to them, oh, you've had so-and-so. And they say, well, I said, well, you know, how did your treatment go? And they say, well, it was great. And I said, well, how much does that cost? And they said, well, no, it's free. Well, it's free at the point of delivery. It's not free. So when I lived in America, I saw a really interesting system. And what happens in the States is you go to visit your doctor, and at the end of everything that's done, you're given a bill. And that's the system that I think would be very useful. So at the end of your inpatient episode, for example, I think it's important that we understand how much has been spent on our care. So let's say you've gone in, you've had an elective procedure, and your care is £50,000. You would then be given an itemised bill saying that the cost of your care was £50,000. The NHS has paid towards your bill £50,000, so your copay is zero. And what that does immediately is it gives you a value proposition. You suddenly understand how much this treatment costs and how brilliant the NHS can be when it works. And it also abolishes waste and it abolishes time wasters. Another big bugbear, if you are paying for the NHS. If you want to see a GP, you should see a GP. And I can tell you, before COVID, there were 24.3 million face-to-face consultations a month. Less than half of the people are now being seen face-to-face. Now, I do believe telemedicine has a role to play. If you are young, if you need a repeat prescription, that's fine. You can absolutely do that. If you are an elderly person with chronic disease, multi-system disease, and there are complexities to that disease, you need to be seen face-to-face by a doctor. And there are repeated incidents of coroner's reports into elderly people who have died because the GPs have refused to see them. It's unacceptable, and yet again, it has to stop. And just whilst I'm at it, the reason I want patients in control, and I think one of the most pertinent things at the moment is the vaccine passport. I'm fundamentally opposed to being told by government ministers that I should be vaccinated. As a rule, we do not believe in compulsory vaccination in this country. And let me ask you a question. We have protected the elderly and vulnerable, and I'm really thrilled about that. The uptake's been incredible, and the United Kingdom has been at the forefront of that. But let me ask you a question. Why are we forcing children to have a vaccine? It makes no medical sense. I think it's unethical, immoral, and illegal. I want to put the patient in control, rather like you would leave a review on TripAdvisor about a hotel. Why don't we leave a review on a clinical setting? Why don't we rank our GPs? Why don't we rank the hospitals? They'll soon up their game if they get a 1-star rating, won't they? It's also worth saying that doctors and nurses do make mistakes, but it's very important to learn from them. And we've got to stop the culture of cover-up. My cousin died as a result of medical negligence. It went to a coroner's court, and in court, the doctors lied, the nurses lied. They covered it up, and so we got a verdict as death by misadventure. That's not acceptable. We have to be honest and transparent, and sometimes things do go wrong in medicine. But when you cover things up, we never learn. So let's be open and honest and learn from our mistakes. No more cover-ups and no more excuses. And now I've completely lost my pace in the... So that was that. And then the final point I want to make really of this plan, he said, hastily shuffling his papers, is that essentially what I want to do is to build resilience into the system. And we can do that in a number of ways. It strikes me that we are always surprised when there is a crisis around the corner. The fact is we're always surprised when flu comes around the corner. We have absolutely no capacity. What we showed with the Nightingale hospitals was that actually, using the army, we can mobilise very quickly. There is a role to play for having healthcare facilities that are ready, that are basically shelf-ready, that we can then roll out in times of crisis. There are 50,000 medics like me who are retired. I have my license back, I can prescribe, but I'm not used. And in that COVID, they asked us to come forward. They never used us. There are 50,000 of us that could be a territorial army of doctors. We need to keep them trained, keep them ready, and therefore they would boost capacity within the NHS. So that's really the 4-point plan. I just want to show you that again. So 0 waiting lists, reduce and improve management, put patients in control, and increase frontline capacity. All of this can be done. It is very straightforward in how to do that. I want to leave you with a very quick take-home message. Doing nothing is not an option. We cannot keep hiding from it. We have an increasingly aging population, the NHS is not fit for purpose, and it has to be reformed. And throwing money, which is what the Conservatives want to do, it's what Labour want to do, doesn't solve a problem. You just get a very expensive problem. That money does not solve the problem. It's also vital to me that we keep the NHS free at the point of need, so that when you're ill, you get help and it is paid for by the state. We need to know the parts of the NHS that are working well, those that are failing, and we need to put those parts of the NHS that are failing right. And we believe really passionately that our bold, ambitious plan can get waiting lists down and can keep them down. And this is not about dismantling the NHS. Actually, it's quite the reverse. It is about arming and equipping the NHS to face the next 75 years. And this is about building great British health for you, for your family, and for your loved ones. Thank you.